Hello, and welcome to this video on the development in infancy and toddlerhood. Infants and toddlers may develop at different rates, thus we need to know how we can tailor our interactions to suit their developmental needs. In this lesson, we will talk about the psychological, social, and emotional development in children between the ages of 0 to 3. We will be discussing the evolving abilities of typically developing infants and toddlers in these various domains. A baby's primary psychological need in infancy is to form an attachment to caregivers. Ideally, infants should develop a secure attachment to caregivers to give him or her the best psychological outcomes in life. A secure attachment is formed by a warm, responsive caregiver who gives the infant predictable and sensible routines. An infant enjoys using his or her senses and developing skills for which to explore and experience their world. A baby's brain development is hugely affected by his or her early experiences. Healthy experiences and exposure help the brain to organize itself in a hierarchical manner. Disruption or deprivation of appropriate experiences has a permanent effect on the baby's brain, as certain neurosynapses do not get stimulated and organize itself. This is an irreversible effect. An infant's temperament may also facilitate or make various environmental experiences more difficult. A baby develops his or her first social smile at 6 weeks old. This marks the beginning of meaningful connections a baby can make with adults around him or her, as it is reciprocal. Infants begin to be more conscious of social stimuli such as facial expressions at 5 months of age. At 9 to 12 months of age, which also coincides with their ability to crawl and be more mobile, their interest and desire to explore their surroundings increases. They typically start to develop gestures to indicate their needs, such as pointing. Stranger anxiety develops anywhere between 9 and 18 months old. In toddlerhood, the child begins to identify him or herself as unique from others. Toddlers also begin to be interested in interacting and imitating others, and parallel play often occurs. Most children do not initiate play with others until they are around 3. Children at age 2 typically engage in pretend play, which allows them to understand the world around them and practice problem-solving skills. 3-year-olds typically see themselves as unique persons and can understand the concept of mine or other. The beginnings of interactive play may emerge, and they may become increasingly better at sharing and taking turns. The experiment that was used to assess an infant's attachment style was developed by Mary Ainsworth in 1969, called the Strange Situation. The procedure was carried out in a systematic manner to be able to observe the various attachment styles shown between different mother-infant diets. These infants are generally between 1 and 2 years old. The experiment is done in a small room with a one-way glass so the infant's behavior can be observed. The infant's behaviors is observed across 8 intervals of approximately 3 minutes each. First, mother, baby, and experimenter. Its duration is less than 1 minute. Second, mother and baby alone. Third, stranger joins mother and baby. Fourth, mother gets up to leave and baby and stranger are left alone. Fifth, mother returns and stranger leaves. Sixth, mother leaves, baby is left alone. Seventh, stranger returns. Eighth, mother returns and stranger leaves. Attachment styles are then classified based on interaction behaviors directed towards the mother in 2 reunion time intervals at 5 and 8. Other observed behaviors include exploratory behaviors, for example, moving and looking around the room, playing with the toys, or search behaviors such as following the mother to the door, banging on the door, turning towards the door, looking at the door, moving and/or looking towards mother's empty chair. Lastly, the observers also notice any affect displays, such as crying or smiling or no affect. Mary Ainsworth and her team identified 3 main attachment styles, which were secure, insecure, avoidant, or ambivalent resistant. A 4th attachment style known as disorganized was identified in 1990. These attachment styles are important as they are long-lasting and have an effect on the many kinds of relationships the person will form throughout their lives, like friendships and romantic relationships. Securely attached children form 70% of Mary Ainsworth's sample size. Securely attached children are confident that their attachment figure is available and can meet their needs. The attachment figure is used as a safe base to explore the environment and is sought out in times of distress. This style develops when caregivers are sensitive to their cues and signals and is appropriately responsive to their needs. In the strange situation, securely attached infants show distress when the mother leaves the room. When left alone with a stranger, they exhibit avoidant behavior. However, the baby is friendly with a stranger when the mother is present. When the mother returns to the room, the baby is happy and shows joy upon reunion. Children with this attachment style generally have good working models of themselves and see themselves as valuable within their community and worthy of respect. The insecure or avoidant attachment style is observed in approximately 15% of infants. Insecure avoidant children tend not to turn towards their attachment figure while exploring the environment. Physically and emotionally, they are very independent and do not seek comfort from the attachment figure when distressed. Infants and children who have this attachment style typically have caregivers who are insensitive, not responsive, and rejecting of their needs. The caregiver may withdraw from helping in difficult times and is often not available when the infant is emotionally distressed. In this strange situation, these infants do not exhibit any distress when the mother leaves the room. The infant does not mind the stranger around, and his or her behavior does not change when the stranger is present. Upon reunion, the infant exhibits little interest when the mother returns. Both the mother and stranger can comfort the infant equally well. Avoidantly attached children think of themselves as unworthy and unacceptable. The insecure ambivalent resistant attachment style is seen in approximately 15% of infants. Infants and children with this attachment style behave ambivalently towards attachment figures. For example, they may be observed to be dependent and clingy, but would then reject the attachment figure when engaged in interaction. The infant is unable to develop any feelings of security from attachment figures. Additionally, they have difficulties moving away from the attachment figure to explore new environments. This may appear to be a pull-push situation where the infant would want to pull the caregiver towards him or herself, but when the caregiver attends, the infant would push the caregiver away. When the infant is distressed, the infant is difficult to soothe and does not derive comfort from interaction with the attachment figure. This attachment style arises from inconsistent response levels of the infant's needs from the attachment figure. In this strange situation, these infants exhibit intense levels of distress when the mother leaves the room. The infant is generally avoidant of the stranger and exhibits fear of the stranger. Upon reunion, the infant approaches the mother, but would resist contact or may push the mother away. The infant generally cries much more and does much less exploration than the other 2 types. Ambivalent children tend to have a negative self-image and exaggerate their emotional responses as a way to get attention. Children with insecure or avoidant attachment styles and insecure ambivalent resistant attachment styles are generally associated with a higher risk of social and emotional behavioral problems. Infants can display basic emotions such as happiness, fear, sadness, anger, and loneliness. However, they have limited ways in which they can display these emotions, which often leads to parents feeling helpless regarding the reading of their infant's emotional cues. Towards the end of the toddler's 2nd year, with increasing ability to express emotions, they also start to experience more complex emotions such as pride, shame, embarrassment, and guilt. The toddler's environment is just as important in the degree of expression of certain emotions. For example, if caregivers dismiss or discourage the experience and expression of a particular emotion, the toddler will start to internalize that this particular emotion's expression is rare. Advanced 2-year-olds understand what acceptable and unacceptable social behaviors are. This is related to their emerging understanding of self and their self in relation to others. This helps them experience emotions that are directly in response to others and vice versa. 3-year-olds can identify many of their own feelings and that of others. However, they continue to struggle with self-control and emotional regulation. And this is where they need their caregivers to help them manage these emotions. The line between fantasy and reality in 3-year-old toddlers is blurred, and they commonly have difficulties distinguishing between either. 3-year-olds are better able to make independent but limited choices. This helps them build their feelings of competency. With that, I will end this video where we have gone through the psychological, social, and emotional development of children between the ages of 0 to 3. Thank you.